In this video, our subject is exercise. We will discuss getting ready, observing body mechanics and back safety, how to assist with ambulation, how to assist with range of motion exercises, and finishing up. Exercise is essential to maintaining health throughout life. Exercise helps keep the cardiovascular system healthy by stimulating the heart to pump blood more effectively. Exercise can decrease blood pressure, helps prevent muscle weakness and atrophy, and keeps the joints flexible. And exercise helps to reduce bone loss, thus helping to prevent brittleness, which is such a danger to our aging patients and residents. Exercise also aids the digestive process, promotes rest, relaxation and sleep, increases a person's sense of well-being, and helps people to maintain their independence. By helping those in your care with appropriate ambulation and range of motion exercises, you will play a key role in protecting patients and residents from the complications of immobility, and you will enhance their overall quality of life.
Preparation, that is getting ready to manage your work in a manner that is safe, healthful, and efficient, is key to successful health care. No matter what tasks you'll be performing during your shift, whether those tasks are planned or unanticipated, you will benefit from a routine of careful preparation. Begin each interaction with patients or residents by performing these steps. Wash your hands. Gather all needed supplies. Knock before entering the person's room. Introduce yourself using your name and title and greet the person by name, remembering that a friendly greeting helps establish rapport. Carefully identify the person adhering to your facility's approved method. Explain to the person the procedure you're about to perform and make sure the person understands before you begin. If necessary, show visitors where they can wait outside the room. Provide privacy by closing the door and curtain. As appropriate, drape the person for modesty. And then, throughout the procedure, see to safety using proper body mechanics and following all safety precautions for equipment use and infection control.
As a nursing assistant, you will place stress on your body as you lift, push, pull, stoop, and bend repeatedly throughout the workday. In many cases, you will be lifting and moving people and objects that are larger and heavier than you are. If you do not use proper technique, you will risk serious injury to your back. By consistently practicing good body mechanics, however, you will minimize the risk of injuring yourself. And it's not that difficult to do. Body mechanics are as easy as A, B, C. A for alignment, B for balance, and C for coordinated movement. Think of A, or alignment, as good posture. Keeping good alignment through good posture lessens strain on your joints and muscles. Specifically, good alignment keeps your back in a neutral position. B, or balance, involves a wide base of support and a low center of gravity. When you're standing, the base of support is your feet. Separating your feet makes your base of support broader. Your center of gravity is your torso, the heaviest part of your body. Bending your knees puts your center of gravity lower, closer to your base of support. This also takes strain off your back. C, or coordinated body movement, uses the weight of your body to help with movement. This might be as simple as straightening your knees, allowing the momentum of the movement to assist you in your task. It is important to encourage patients or residents who are able to walk to do so, and on a regular basis. Frequent ambulation or walking helps to preserve the person's mobility, improve breathing and circulation, and assist digestion. Ambulation helps the person to remain as independent as possible for as long as possible. Some patients or residents will use an assistive device when walking. Commonly used assistive devices include crutches, walkers, and canes. Canes typically are used by people whose bodies are weak on one side. The cane needs to be the correct height with the handle even with the person's hip. Many canes have a wide base with 3 or 4 tips. The wide base and multiple tips offer more stability than is provided by a cane with a narrow base and just one tip. The person holds the cane on her strong side and places it in front of her body to support her weight while moving. The person moves the weaker leg forward first, followed by the stronger leg. Crutches typically are used when one leg is affected and little or no weight is to be placed on the leg. The use of crutches requires a patient or resident to have good upper body strength and a sense of balance. The person supports her weight on the hand grips to reduce the amount of body weight that she must bear on either one or both legs. Crutches are made of either aluminum or, as shown here, wood. Walkers are used to assist when a person can still bear some weight but may need additional support when getting up or moving. To use the walker, the person grasps the top of the frame, lifts the walker up, then places it squarely on the ground 10 to 18 inches in front of his body. Using the top of the frame for support, the person moves one leg forward and then the other, stepping into the frame of the walker, then repeats the process. The person can use the top of the frame for support between steps if necessary. Before using any assistive devices, check to ensure that they're in good condition. Tips, cushions, and grips on canes and walkers should not be cracked, worn, or missing, and all components should be firmly attached. A transfer belt gives you a secure place to grasp and support the person. When used to help a person with ambulation, a transfer belt is sometimes called a gait belt. Some facilities will require you to use a transfer belt when helping a patient or resident to walk. As a nursing assistant, you will need to understand how to apply and use a transfer belt and in what circumstances. And the first thing to remember is, a transfer belt is only an assistive device. It should never be used to lift or drag a person who is unable to bear weight. Remember, too, that some patients or residents may have medical conditions that make it dangerous to use a transfer belt on them. For example, a transfer belt should not be applied to a person who is recovering from abdominal surgery, and transfer belts are also not used with people with certain heart disorders. If you are in doubt about using a transfer belt on a patient or resident, ask the nurse. In the demonstration that follows, you will see how to use a transfer belt when assisting someone to ambulate. To assist someone with ambulating, start with your getting ready steps. These include washing your hands and taking standard precautions, as well as gathering supplies. In this case, a transfer belt. Make sure the bed is in its lowest position to reduce the risk of a fall. Next, raise the head of the bed as tolerated. Check to make sure the wheels are locked. If the side rails are in use, lower the rail on the working side of the bed, leaving the other rail up. Fan fold the top linens to the foot of the bed. Next, assist the person to dangle on the edge of the bed. To do this, first stand at the side of the bed with your feet spread about 12 inches apart and with your knees slightly bent to protect your back. Next, help the person to move toward the side of the bed nearest you. Have the person roll over onto her side, facing you. Have the person flex her knees and bend the arm she is lying on in preparation for using it to prop her upper body up. Have the person bend her top arm so that her hand is in a position that will enable her to push off the bed. Next, instruct the person to rise to a sitting position by using the elbow of her bottom arm to raise her upper body while pushing against the mattress with her other hand. Advise the person to allow her legs to swing over the edge of the bed while you help to guide her into an upright position. Have the person put her hands on the edge of the bed alongside each thigh for support. The person should now be sitting squarely on both buttocks with her knees apart. The person is now dangling. Dangling is important for the person's safety and should be performed for the specified length of time whenever you move a person from a recumbent position to sitting. Be sure to stay with the person during the entire period of dangling. During this time, observe the person for signs of dizziness or fainting as you position yourself in front of her so you can offer assistance in case she loses balance. If the person feels faint, help her to lie down and call for the nurse. And remember to ask the person if she feels dizzy or faint.
How do you feel? Do you feel faint or dizzy? Are you all right?
Oh, I feel fine. Thank you.
Before proceeding with ambulation, check the person's pulse. If the pulse is weak or if the person complains of dizziness, stay with her and alert the nurse before attempting ambulation. But make sure to assist the person back to a supine position before notifying the nurse. Next, help the person put on her shoes or slippers. And help her into a robe. For safety, make sure that clothing fits snugly and does not hang loose or drag. When the person is ready, apply the transfer belt around her waist, over top of all her clothing. Buckle the belt in front. Before you tighten the belt, turn it so the buckle is off-center, perhaps even off to the side. Tighten the belt and check for fit. It should be snug, but you should be able to slip your fingers between it and the person's waist. If you're putting the belt on a woman, make sure you do not trap her breasts beneath the belt. Next, you will help the person to stand. Stand facing the person. Have the person put her hands on the edge of the bed alongside each thigh. Make sure the person's feet are flat on the floor. Then have the person lean forward. Grasp the transfer belt at each side using an underhand grasp. Position your feet alongside the person's feet, flexing your knees. Your shins will be against the person's shins. This technique helps to block the person's feet and keep her knees from buckling as she stands up. Have the person push down on the bed with her hands and stand on the count of 3. Assist the person into a standing position by pulling on the transfer belt as you straighten your knees. If use of a transfer belt is contraindicated for your patient or resident, you can assist the person into a standing position using a different technique. Place your hands on the person's upper back and gently pull her up and forward as you straighten your knees. Remember to keep your back straight. Have the person grasp the cane or walker, if she is using one, in order to maintain balance. Remember, the person should hold the cane on her strong side. Help the person to walk. Stand slightly behind the person on her weaker side. Grasp the transfer belt with an underhand grip from the back. Make sure the person is using any ambulation device correctly. After returning to the person's room, help the person back into bed or a chair. After assisting with ambulation, complete your finishing up steps as described in the final section of this video. When assisting with ambulation, be sure to tell the nurse if you observe any of the following. Assistive devices such as canes or walkers are not in good working condition. The person complains of dizziness, chest pain, a rapid or irregular heartbeat, or sudden head pain. The person complains of pain when trying to bear weight, and this is new. The person displays any changes in her usual grip, strength, or ability. A person who is usually cooperative refuses to participate, or if the person's vital signs do not return to their normal resting rates after the activity ends. Helping a patient or resident to walk can be a risky business. Often, weakness or fatigue places the person at a higher risk for falling. The risk of falling can be reduced with some advanced planning. To help prevent a fall, focus on the task. Understand the person's ability and level of endurance. Use assistive devices as appropriate. And make sure the area is safe. If a fall does occur, do not attempt to prevent the fall by grabbing the person's arms, as this could cause injury. Instead, control the fall.
I have to sit down.
We're almost to your bed. Do you think you can make it?
Hold the person next to your body and allow her to slide gently to the floor as you assume a sitting position. This will allow you to protect the person's head.
Somebody help!
Get assistance from the nurse. Do not try to lift the person by yourself. After the patient or resident is safe, be sure to document the events that occurred leading up to, during, and after the fall per your facility's policy. Some people may not be able to get out of bed to ambulate, but they still need to exercise their joints and muscles. Range of motion exercises, which are movements that put each joint through its complete extent of motion, are done to preserve joint and muscle function in people who have limited use of their musculoskeletal system. Without range of motion exercises, patients or residents may suffer from loss of bone strength leading to brittle bones, muscle atrophy, which is the wasting away of the muscle, leading to permanent muscle weakness, and stiffness of the joints, leading to contractures. Range of motion activities typically take three forms. Active, meaning the person can perform the exercises independently. Active assistive, meaning the person performs the exercises with some hands-on assistance from the nursing assistant. And passive, meaning the nursing assistant moves the person's joints through their range of motion without active involvement on the part of the person. When assisting a patient or resident with range of motion exercises, be sure to follow the person's care plan. The exercise of all the joints may not be appropriate for some patients or residents. Expose only one body part at a time and repeat each exercise the specified number of times, usually 3 to 5 repetitions. Remember that range of motion is the extent that any joint can be moved without pain or resistance.
How does that feel? You okay?
Okay.
All right, good.
Never try to force a joint to move if you feel resistance or if the person seems to be in pain. Before conducting range of motion exercises with a patient or resident, begin with your getting ready steps. These include washing your hands and gathering your supplies. In this case, a bath blanket. Position the bed at a comfortable working height. Raise or lower the head of the bed to a horizontal or semi-Fowler's position and make sure the person is supine. Then make sure the wheels are locked. If the side rails are in use, lower the side rail on the working side of the bed. The side rail on the opposite side of the bed should remain up. Spread the bath blanket over the top linens and the person. If the person is able, have him hold the bath blanket. If not, tuck the corners under the person's shoulders. Fan fold the top linens to the foot of the bed. Provided your facility permits you to do so, begin by exercising the person's neck. Support the person's head by putting one hand under the person's chin and the other on the back of the head. Gently bring the head forward, as if to touch the chin to the chest. Then bring the head backward, chin pointing to the sky. Next, support the person's head by putting one hand under the person's chin and the other near the opposite temple. Gently tilt the head toward the right shoulder and then toward the left. Finally, support the person's head by putting one hand under the person's chin and the other on the back of the head again. Gently rotate the head from side to side, as if the person were shaking his head no. Next, exercise the person's shoulder with forward flexion and extension. Flexion is the bending of a joint, while extension is the straightening of a joint. Support the person's arm by putting one hand under the person's elbow and the other under the person's wrist. Keeping the person's arm straight with the palm facing up, lift the arm up so that it is alongside the person's ear. Then return it to its original position. Next comes abduction and adduction of the shoulder. Abduction is moving a body part away from the midline of the body. Adduction is moving a body part toward the midline of the body. Support the person's arm by putting one hand under his elbow and the other under his wrist. Keeping the person's arm straight with the palm facing up, move the person's arm away from the side of his body. Then return it to its original position. For horizontal abduction and adduction, support the person's arm by putting one hand under the person's elbow and the other under his wrist. Keeping the person's arm straight with the palm facing up, move his arm away from the side of his body. Gently bending the person's elbow, touch the person's hand to the opposite shoulder. Then straighten the elbow and bring the arm back out to the side. To rotate the shoulder, support the person's arm by putting one hand under his elbow and the other under his wrist. Move the person's arm away from the side of his body and bend his arm at the elbow. Gently move the person's forearm up so that it forms a right angle with the mattress, and then back down. Next, exercise the person's elbow, beginning with flexion and extension. Support the person's arm by putting one hand under his elbow and the other under his wrist. Starting with the person's arm straight and with the palm facing up, bend his elbow so that his hand moves toward his shoulder. Then, straighten out the elbow, returning the person's hand to its original position. Next comes pronation and supination of the elbow. Pronation is rotation so that the palm is facing down or backward. Supination is rotation so that the palm is facing up or forward. Support the person's arm by putting one hand under his elbow and the other under his wrist. Move the person's arm away from the side of his body and slightly bend the arm at the elbow. Gently move the person's forearm up so that it forms a right angle with the mattress. Gently turn the person's hand so that the palm is facing the foot of the bed. Then turn the hand the other way so that the palm is facing the head of the bed. Next, exercise the person's wrist, beginning with flexion and extension. Support the person's wrist with one hand. Use the other hand to gently bend the hand down and then back. To perform radial and ulnar flexion of the wrist, support the person's wrist with one hand. Use the other hand to gently turn the person's hand toward his thumb. Then turn the hand the other way toward the little finger. For flexion and extension of the fingers and thumb, support the person's wrist with one hand. Using your other hand, flex the person's fingers to make a fist, tucking the person's thumb under the fingers. Then straighten each finger and the thumb one by one. Next, perform abduction and adduction of the fingers and thumb. With one hand, hold the person's thumb and index finger together. With the other hand, move the middle finger away from the index finger. Then move the middle finger back toward the index finger and hold the middle finger, index finger, and thumb together. Next, move the ring finger away from the other two fingers and thumb, then move it back toward the group. Do the same with the little finger. Finally, reverse the process. Hold the little finger and the ring finger together and move the middle finger away and back. Next, the index finger, then the thumb. Next, perform flexion and extension of the thumb by moving the person's thumb into his palm, then returning it to its original position. Perform opposition by touching each fingertip to the thumb. When you have finished the exercises on one arm, repeat them with the other arm unless instructed otherwise. Next, exercise the person's hip and knee, beginning with forward flexion and extension. Support the person's leg by putting one hand under the person's knee and the other under his ankle. Gently bend the person's knee, moving it toward him. Then straighten the person's knee and gently lower the leg to the bed. Next, perform abduction and adduction of the hip. Support the person's leg by putting one hand under his knee and the other under his ankle. Keeping the person's leg straight, move his leg away from the side of his body, then return it to its original position. Follow this with rotation of the hip. Support the person's leg by putting one hand under his knee and the other under his ankle. Keeping the person's leg straight, gently turn the leg inward and then outward. Next comes dorsiflexion and plantar flexion of the ankle and foot. Dorsiflexion is bending the foot upward at the ankle by pulling the toes toward the head. Plantar flexion is flexing the arch of the foot by pointing the toes downward. Support the person's ankle with one hand. Use the other hand to gently bend the person's foot up toward the head and then back. Next comes inversion and eversion of the ankle and foot. Inversion is rotation of the sole of the foot inward. Eversion is rotation of the sole of the foot outward. Support the person's ankle with one hand. Use the other hand to gently turn the inside of the foot inward and then outward. Next, perform flexion and extension of the person's toes. Put one hand under the person's foot. Put the other hand over the person's toes. Curl the toes downward and then straighten them. Abduction and adduction of the person's toes is performed by moving each toe the same way you spread each finger in the finger exercises. When you have finished the exercises on one leg, repeat them with the other leg unless instructed otherwise. Finish by straightening the bed linens and making sure the person is comfortable and in good body alignment. Draw the top linens over the person. Remove the bath blanket. If the side rails are in use, raise them now. Then dispose of the bath blanket in the soiled linen hamper. And then complete your finishing up steps as described in the final section of this video. While performing range of motion exercises, tell the nurse right away if you observe any of the following. A person who is usually cooperative refuses to participate. The person's vital signs do not return to their normal resting rates after the activity ends. You observe any new redness or swelling of a joint. The person complains of new or different pain when moving a joint, or if the person's usual range of motion of a joint has decreased. When you have finished with a procedure, always follow a routine of finishing up to ensure your patient's or resident's safety and comfort. First, confirm comfort and good body alignment, whether the person is seated or in a bed. Leave the person's call light control within easy reach, and do the same for any other items the person may want, such as remote control devices, the telephone, or fresh water. Next, see to safety. If appropriate, return the bed to its lowest position. Then, make sure the wheels are locked for safety, and place the side rails in ordered or requested positions. If desired, open the curtain or door and ask whether the person would like for visitors to return. If you used gloves, first discard them according to your facility's policy. Then, wash your hands. Finally, report and record all pertinent information about the procedure, including the date and time of the procedure and your full name and title.